Hi, I'm Kirk Jowers, and welcome with Dr. Russell Osgathorpe. Russ, thank you for being with us again.
My pleasure.
We'll start with this graphic from the World Health Organization. There are now 184,976 confirmed cases, 7,529 deaths, and 159 countries with cases. Yeah, that's my first question to you. Europe is experiencing critical shortages of medical supplies, which extends now beyond northern Italy. Attorney General William Barr here in the United States is asking federal prosecutors to crack down on people spreading false claims and scams. 37 states in the U.S. have closed public schools. In California, 7 million residents and climbing have been ordered to shelter in place.
Yeah, that was a big one.
It's a big one. It goes to your social distancing you've talked about a lot with us.
Yep.
Today's stocks rebounded a bit after yesterday's excruciating 3,000-point loss. It finished up over 1,000 points for the day. And in, I guess, coordination with the economic issues, various proposals from the White House, Senate, many states and municipalities are trying to get a handle on the economic consequences of this. Likewise, country by country, we could say the same thing.
The economic consequences almost seem as scary sometimes as the actual cases.
It does to me too. I've got friends in Italy that are talking about life there and industries going down, and of course small business probably have it more tough.
Yeah, the effects of the economic downturn are going to be felt for a while.
So let me get straight to the questions. The United States is way behind many other countries in our testing, although there are other countries that have done none to almost no testing. What does this lack of testing portend?
The lack of testing is a real problem. For example, if you knew you had the virus, it would change how you would act for an average member of society.
Right.
You would say, okay, I'm positive, I'm staying home, right? But if you didn't know you had the virus, and we've all heard that there are other viruses circulating, then maybe you just kind of say, well, I just think I have the cold, maybe I won't change the way I behave that much. And that's the problem. If we have widely available testing, we can isolate, quarantine, and respond differently both as governments as well as individual members of society. So testing is really, really important. And it's going to be a while, I think, before, for example, in the United States, we have available testing that is widely available. We're ramping up right now, but we're still far short of the tests that we need.
And the final question, again, thank you everyone for your comments and for watching and contributing. Several people have asked, how should people take care of loved ones who have COVID-19 or have symptoms consistent with COVID-19?
Although there are a few cases that are positive, relatively speaking, per the size of the population in the United States or around the world, for that matter, it's important to understand the answer to the question you just asked. If I'm asked to care for my husband or my child or my young adult who's living at home with this virus, what do I do? I think the best advice I'd give is the Centers for Disease Control on their website has a whole section of COVID-19 response dedicated to this exact thing.
Okay.
And the highlights of that are if you are a caregiver for somebody with COVID-19 or with symptoms consistent with COVID-19, that person, ideally, the person with symptoms, will be isolated to a room in your home that, if it's available, if your home has this available, they would be in a separate room behind a closed door with its own bathroom. Yeah. And if that can be the case, then that socially distances you from the people within your own home. If you are going into that room to deliver food or to take out laundry or to clean, do so with rigorous hand washing and, where possible, a glove and a mask. You are in effect a caregiver of that patient who is your family member. And so you want to limit the spread of that virus to you as the caregiver, much the same way a doctor or a nurse or a respiratory therapist would if they were caring for somebody in a hospital.
Right.
And so if your family member doesn't need a hospital and can be cared for at home, you're going to be the one that needs to do the protective measures to limit spread within your own home.
Thank you so much, and thank you for joining us. We'll see you tomorrow.